me that bag over here, please. The one on the right. Yeah. Yeah. And the one on the left, too. Why not?
Better light.
There we go. Yeah. Okay. Now, when we take the tape off, you want to hold the skin tight so it doesn't pull at the incision side.
Okay.
Hold on, I'm gonna get up here, John.
Just kind of loosen the edges right now. Okay. I'm going to hold the skin down.
Okay.
You all right?
Hold the skin down.
You're cold? Is that what you
I
said?
said there's a big hole.
Yeah. She knows.
Okay. And see how this is out like this? You always want to have enough to pull it out. Yeah.
Okay. Yeah.
Okay. You ready? Deep
Yeah.
breath in. And we're done.
And we're done. Okay, so it's not. It's kind of like that's the first time I've looked right into it. It's like that. It's like a pocket.
Yeah, and it's
Nothing
healing.
wrong.
Yeah.
It's healing from the bottom up.
So you change gloves.
Yeah, because that's dirty
That's
now.
contaminated.
Right. So now I'm
So I
clean.
need
And
to
this is
get-
not a sterile technique. It's,
No.
You know, but we still want to.
Yeah, it's sterile as
Right.
so.
Right.
So you glove up,
Uh-huh.
then you remove the
So I need to get
bandage,
some gloves. Well, I've
We'll
got
bring you some out.
Okay. Okay. You will?
and then
Okay.
you take it out by holding it with the gloves, and then you discard it. Then you take those gloves off, re-glove.
Okay. Now, I'm just barely going to clean it. Well, you know what I mean. I'm barely going to pour some in. I didn't mean barely clean it.
Yeah.
Green.
Yeah.
Yeah.
Right. Okay.
I meant gently.
You're going to pour a small amount of
Right.
cleaning material
Thank you.
into the wound.
Place that on top. While
Leave
I'm,
leave
See,
the
they
gauze
didn't
in
do that at the
place.
hospital.
I didn't clean it.
No. No. No, I'm serious.
Well, but it was.
No,
it
no,
had-
no, but I mean, I'm serious.
Are you
did
sure they
not-
didn't use a spray cleanser or
No,
something?
no.
No, they
I'm
didn't.
positive of that. They pulled it out and they immediately would repack it.
Uh-huh.
They did not put anything, they did not pour anything in there.
Okay, now I'm going to use the edge of this and just kind of blot that up. Real gentle.
Okay.
Okay, so using the edge of the gauze, you gently blot the
Yeah.
area to
And now I'm-
remove the cleaning material.
making
And
sure
now
there's
I'm pushing
nothing-
it to kind of see that extra coming out right there?
Gently push the two edges
Right.
together to remove the excess cleaning material.
And now I'm going to measure you, which you don't have to do.
Okay, measuring the wound.
We are 2.8 by 1.
Okay.
It's not gonna
2.8
hurt.
by 1. These are
She's
centimeters.
just getting excess, aren't you? Of that cleaning?
I'm measuring the depth.
Oh,
Right.
okay.
This is not going to hurt. Didn't hurt, did it?
No, no,
Okay.
it
Good.
didn't.
Good.
I
Measure.
was having
2.8
anxiety.
by 1 by 2.2.
And these are what form of measurement?
Width.
Centimeters,
You write that down
Yeah.
for me? Yeah, centimeters.
centimeters.
2.8
These are not inches,
by
Emily.
1 by
2.2.
Well, that's a lot smaller than when
It's
you,
way smaller.
when
It's
you first did it.
no, it's the same size as it always was.
yeah. No,
It's
it looks
not
good.
a
It
3-inch wound.
no,
It's
no, it looks
centimeters.
good.
Centimeters.
Now, I took the
Okay.
lid off. You always want to have your lid
Open.
up. Correct.
Yeah,
Up.
yeah.
Okay. Now, this is what this looks like on the inside. It looks a little different from the one I'm leaving.
Yeah.
Hold it to the camera too.
There's a cotton ball. You're going to take...
Let me hold the camera up. Okay.
You're going to take a Q-tip
Where is it? Oh, there it is. Okay.
and go underneath the cotton ball
To grab the end.
and, yeah, to try to find the end. I have to look at what I'm doing, though.
Okay.
Yeah, I'm just digging around till I find the end to pull up here. May take me a minute. There we go. I think. Yep, that's it. If I can get it.
Grasp
Okay,
the end
see
of
the
the
end?
tape with the Q-tip.
Yeah.
Now, this end right here is considered dirty. I'm going to touch it.
Okay.
Okay? The end that's going inside her body is going to be the other end, the clean end. Make sense?
Yes.
Okay. And also, this gauze is soaked with dried betadine, so that keeps the wound clean too. So I'm going to pull this out. Always pull out too much. Okay.
She's got about 1.5 feet.
Yeah, open that up for me, please. These are sterile scissors. After I use them today, we'll take an alcohol
And
prep
clean 'em.
and clean them each time. Other end.
Where the arrow is.
Yeah.
Okay. The
Cut
top
that tip off.
the top end of the betadine tape is considered the dirty end and needs to be removed. The scissors are sterile.
Don't
You
say
cut
it's
the
Robert
clean
Fine.
end.
Okay, when I cut this,
Okay.
It's Robert Fine.
yeah, 'cause I'm gonna put that.
Okay.
Now, when I cut that, I'm gonna leave a little tail out and put my lid on, where you don't have to dig around in there
Right.
for that. Does that make sense?
Yeah.
Hold that up for me, please.
And that's what makes that end the dirty end because it's
Right.
sticking out a little bit.
Right.
Okay. But the dirty end never touches the patient's
Right.
wound.
Okay, so now we're just gonna kind of,
Feed it in.
yeah,
Yeah. Deep.
there. And then you take the Q-tip
And, yeah,
and twirl it
see?
in. Will you
Yeah.
pick off that cotton? Thank you.
There.
Won't separate people, Jose. Just like the high rates that phone companies charge you when you call internationally. So we're breaking these borders down so people can call Mexico as much as they want.
And you're gonna pack, not packed like a can of sardines,
Yeah.
firmly but loosely, because you got to give the tissue room to expand. Okay.
Say that again. The tape needs to be packed loosely
Firmly but loosely.
firmly but
Because the
loosely.
tissue has to have room to grow together. If it's packed too tight, it won't grow together.
Right.
They wouldn't have the.
If you pack it too tight, the wound won't close. So you have to do it firmly but loosely.
Okay.
Now she's cutting off the dirty end.
That's throwaway right there.
Okay.
Okay. You told us. So see, I left enough out where, in case something happens, you don't want that to get lost inside her body.
Yeah.
Right.
Dig in.
Yeah.
Okay. Now.
So leave enough of the tape extended from the wound to be able to retrieve the tape.
Oh, here's what I'm looking for. Yeah, it wasn't really draining that much. It's a daily dressing change. So
Cover the wound and the end of the tape with a 2x2 gauze pad. Two 2x2 gauze pads.
And then I'm going to take an ABD.
Cover the wound with a half of a ABD pad. Cut the ABD pad in half with sterile scissors.
And then we can reuse that.
Return the unused portion to the package for reuse.
Looks like I put on
For use tomorrow, not reuse.
blue line out.
Blue line faces out.
Yeah.
Oh God, I have all this out.
Yeah.
It sounds complicated, but it's really not.
Yeah.
It's really not. It's just a matter of paying attention, being organized, and taking
your
care of the
tape
daily.
And this tape right here is perforated like every. Can you see the little lines?
Okay, the tape is perforated.
Yeah,
Pull
so-
at the perforations.
Yeah.
Every inch and a half or something
Yeah.
like that.
Yeah.
Cool.
And if this loosens, just add more to it.
Kane, low battery.
It's okay. If she can plan, she'll still have plenty.
Okay.
Oh, I'm glad you had all this, Kane.
Yeah.
It's pretty cool.
That's
Glad
a
you had all this.
that's a
stuff.
clear example of it's always better to ask for forgiveness than permission.
That's right.
So will
Okay.
all the swelling go down?
It will.
It's
It'll take time.
distended, Emily.
Yeah. It's not, your stomach is not
You're
swollen.
not. You're not all swole up, honey.
She keeps thinking
Swole
her
up
stomach.
like
You
a
don't,
boiling
no,
pot.
you're
Oh,
not.
this has an ostomy opening. I'm not going to change this one until there's
Okay.
visible drainage.
Uh-huh.
This has under here. It's got, you know what an ostomy thing is, right?
Well, yeah, but they didn't tell us that. Yes, when the first one they put us in, it was just the
stitch.
line went directly and it was stitched. There was no opening. She now has an ostomy they have not informed us of.
No, it's not
To-
an ostomy.
not
it's
an actual-
ostomy dressing.
Dressing.
top
Oh,
around
okay.
The drainage.
Okay,
tube.
thank you. I was
You were
okay.
freaking, weren't
I
you?
was
Yeah.
going. Oh, I wish they would have
Yeah.
mentioned that.
And that outer dry bandage only needs to be changed if you see drainage through, because we need that appliance to stick as much as possible.
Okay, it's
without
black
messing
now.
with it. Does that make sense?
Kane.
Yeah.
Okay.
I think they said something about
Oh no,
that.
it's back.
All right, let me
Oh,
find
you-
your drain
you
and
closed
empty you.
Oh
Okay.
no, it goes away when I put it up here.
Thank you. You did.
The camera.
Okay.
Very
Oh, the
good.
Where is
king.
it?
It's,
Oh, your fingers are over the.
Oh.
the
oh, oh,
There.
oh, there we go. Okay,
We
so
lost
can
the
you
thing.
say
Where's her bulb?
Wait, here it is. Here it is.
she lays
Okay.
it?
No,
Okay.
this is hooked into that.
Yes.
Yeah.
Put this back in.
So that's why she's calling
Yeah,
it an
put that
ostomy
little-
dressing.
Oh.
Right.
Okay.
So, let me show you. Can you see
Okay.
this round thing and brown thing right here?
Yeah.
That's like a wafer around with a dry dressing on top.
Right. And
Okay.
before, this blue line was directly in your body. So now there's another piece holding
That you don't ever
that,
change. or
that you
mess
don't do anything to.
with. Okay, now
Except I'm
to
trying to show a
empty.
picture
Y'all
of
already know how to empty this.
it.
Okay.
I think.
Yeah, we've pulled the pin on the grenade. Pour it in, you squeeze it,
And then you
Keep it shut.
then you close the lid.
close that. Like
Close
you
that.
pushed it, your thumb.
Right.
Yeah, just push it.
It won't
in.
work if this is not squeezed in together.
Okay.
Okay.
Oh, okay.
Now I'll let you say putting that back
And they
up.
showed us how to squeeze this stuff down.
And you know there's measurements on here.
Yeah.
Yeah.
Yes.
You can see them.
Yeah.
There's 20.
Yes.
So that's
It's not
about
even
10.
10
Yeah.
cc.
10
Uh-huh.
cc's.
Yeah.
So once
And,
once a day we're gonna measure that and report it,
Okay.
and then so we can empty this out.
Okay.
Yeah, when you're
You need me
supposed to
to
put it in
fasten
the
this back for
toilet.
you?
Okay.
Okay.
Now I did not get
I don't know
any
where.
video of the
Bring that
drain.
back tomorrow and we'll video it tomorrow.
Okay.
Okay.
So did
we
you
need
hear that,
to-
Kane? We need to bring this tomorrow so that they can video
No.
the ostomy dressing.
Okay.
Right, right.
Yeah, that's what it was. I just had it pinned on.
Well, let's get your binder fixed first, and then we'll pin it up. That sound good?
Now I can flush this.
Flush.
Yeah. People are describing it as being taken by the fairies, or whether people are describing being taken by UFO aliens.
You lift up your butt just a minute. Because you hate it when it's...
Native American folklore, tribal priests
Nobody look.
and shamans
Nobody look.
are able to reach a higher state of consciousness by communicating
Now, is that too tight?
with the spirit world. Traditional shamans
Now, where do you want this
all
fastened
states
to?
of consciousness, and many of them believe that they are dealing now with spirits. Could these
You pin it
actually be
someplace to keep it from going under your bottom when you're lying down. Too.
Yeah, and then you want to keep the level of the bulb lower than the drain opening, so it's draining by gravity, not going back up inside of you. Yeah, it's right
Drain
here.
is right
Right
here.
Oh, then it has to be.
It has to be down.
psychically. So in many ways,
Oh, I forgot that. I'm not used to that little strip.
sort of being
I didn't have the little strip on the numerous binders that I've had, but it's definitely a good
You know,
idea.
what did you know? We ran into somebody
Breathy.
at the hospital.
You hear it? Okay.
Is it pain that's causing you?
telepathic messages.
You having pain right now?
May be a form
We
of
are
abduction,
Okay.
as some believe.
What are you trying to do?
And should
You wanna get
be
up?
fearful of
I was
what could
trying
very
to-
well
I
be
don't know.
considered
I was trying to ask
alien
her.
mind control.
Okay, she can hear you even though she's not looking at you.
Sound like that's sticking out.
Somebody at the hospital that
That
had
otherworldly
a
contact
black back
is not
thing,
only benign,
but it also was in a dog.
for our very survival.
And they said they paid $115 for it.
Well, a back brace is completely different than an abdominal binder.
But with the people that make the back brace like that quality make them done. I mean, do you know if it
I don't know.
I think you have the best one on the market.
What?
Yeah. Yeah, I don't think you need one of those. Let me tell you why. Because you want to use your abdominal muscles to heal. Those back braces make your abdominal and back muscles weak. But it's great if you have a back injury.
Right, but you don't have a back injury. So you just need,
Most orthopedic doctors hate back braces.
Well, and this thing, should I be
Got
wearing
your
it?
shoulder,
Or they just
for
leave it
now,
today?
for now.
Take it off very often.
Is that trash?
That's good. My trash. What's that trash? All this is trash right here.
Let me get a Walmart bag.
Okay.
She's asking you about how often to wear the binder.
Should I wear it continuously? Go further.
And we have, once we get the other one washed, we can alternate it.
Like that's trash.
Yeah.
All this is trash right here.
Yeah.
I don't want to have to buy new pants because then my
Do what?
feet
You don't want what?
Have to buy new pants. 248 by 1 by 242.
Yeah.
Well, I wouldn't try to wear anything but elastic tops right now. You've got several of those.
Well, I got 3 or 4 of these.
Yeah.
Plus there are other things.
Well, you know, the phrase homebound came out of,
Is that it? Trash
Yeah.
was?
Tisa, I got your name right, huh? Tisa said the word homebound. That means if they see you out on Charbar Circle or on Raintree Lane,
Frolicking about.
they will remove their services. It is required by law.
They ain't gonna find me out there, I can't do it.
Okay. Because if you're well enough to do that, you're not well. You're too well for their services.
Alright, what time is it? 150?
Yeah. 152.
10, Today's the 17th.
When it comes to being better, what's better?
Okay.
Being better or worse?
Want to keep this inside the folder?
And what do
You want the log sheet inside the folder, John?
Okay, let's see what you got.
Did you write that down?
I did.
Okay.
Queen who?
Are you,
Okay.
you ready for the dog thing? She's,
Yeah, you know what?
What?
We should pinch stuff up for her and give them to her when she comes out of Saturday.
Better is better. And AT&T is the nation.
Now, tomorrow this visit won't be this bad. We won't have to go over all this
I know.
stuff, so.
But I sure appreciate your time and all your effort. Gotta start somewhere, huh?
Yeah.
go baby. Here, Russ.
And then, as always, when you're doing wound care, wash your hands, get your stuff ready. Now, and it's hard to do that on the first time because you really don't know until you look at it. Words don't match pictures, you know what I mean?
Right.
Yeah.
Yeah, so you have to
Well,
get,
and
wash
really,
your,
there's really, unless something really happens, I'm not gonna have to do that. I'm gonna just, I mean, I'll just wait for y'all.
Right.
Right.
I mean, that's, I need to know,
Uh-huh.
you know.
But now, if her insurance doesn't approve but 3
Yeah,
visits,
yeah,
you'll have
yeah.
to do it starting
Start, yeah, no,
probably
that's-
Wednesday.
Wednesday.
Yeah,
Yeah,
yeah.
you have a 3-day window to learn how to do
Yeah,
it.
yeah.
Yeah.
And she's saying that if you might be able to fudge the window a day because of the
Because of
weekend,
the doctor.
if they,
Right.
yeah. But
Russ,
they're also, if it was, unless you're not able to do it.
yeah, yeah, no. Do
And
that,
unfortunately, her wound is opened up more.
Yeah.
We have wounds that are so tight but deep, you have to pack with the other end of the Q-tip.
oh,
Yeah.
yeah, oh, wow, wow.
So, but hers will be getting smaller.
Yeah.
Hopefully, it'll go growing the same.
Yeah,
You know.
yeah, inside out. Yeah, hopefully. Is there anything that she could do that would prevent that from happening?
X-rays.
No. The main thing is, part of the purpose of packing it, the gauze is gonna not allow it to heal over on the top and be open underneath it. That's the purpose of packing it,
Yeah.
to let it heal from the inside out. Yeah.
Because if you don't pack it, the skin will heal at
And
the
it'll-
top, and then you'll eventually create a fistula.
Uh-huh.
I think what we're saying as well, though, and reinforce our being firm with her, she does not need to be doing anything because she has an open wound.
Exactly. And let me tell you what'll happen.
There,
You
thank
need,
you.
you need to heal once, not 2 or 3 times. If you don't heal properly the first time, you will have problems with this forever. Because you'll think it's healed 3 months down the road, it'll abscess, or it'll make like a sore inside of you, and you'll have to go in and open it up and clean it out, and you'll start all over. You gotta heal right one time. Don't be impatient. Let it take its time. And basically, healthcare is common sense. You gotta rest. Your body has to have rest in order to repair itself. You gotta eat nutritiously, drink your water, and exercise only is tolerated. You know what I mean? Exercise, only do what therapy tells you to
It
do.
doesn't mean that because you could walk 3 miles a day 11 days ago, that you will be walking 3 miles a day anytime soon.
Right.
You will be
Yeah.
it will take you weeks to walk 3 blocks.
Mhm.
Weeks.
Yeah.
And you don't want sweat getting in that wound either.
Yeah. Oh gosh, I hadn't thought about that. Yeah. You just need to just,
Your body, you're gonna have
We
some
need to-
atrophy of your muscles
Wasting away.
before, over the next 6 weeks, because it's gonna take at least 6 to 8 weeks for the 2 wounds to get to for the internal surgical wound, for the drain wounds, and the open wound in the center of your abdomen to heal. If you resume normal levels of activity before that period, it will create a fistula.
And the reason you have a drain in is because the wound is draining too much for a normal bandage to hold it. They want that drainage out from your internal organs so it can heal better too.